Adolescent and young adult health. Nearly 5,000 people every day, or over 1.5 million adolescents and young adults aged 10 to 24, perished in 2020. Of all the age categories, young adolescents, 10 to 14 years old, had the lowest mortality rate. The major causes of death for teenagers and young adults include injuries, violence, self-harm, and maternal conditions, including drowning and injuries from traffic accidents. Half of adult mental health illnesses begin by the age of 14, but the majority of instances go undiagnosed and untreated. Persons of younger ages are disproportionately affected by substance use when compared to people of older ages, and early initiation of substance use is related with higher risks of developing dependency and other issues during adult life. In 2020, there were 41 births per 1,000 girls between the ages of 15 and 19 worldwide. Overview. Teenagers and young adults' odds of survival vary drastically around the world. In 2020, Sub-Saharan Africa, Oceania, apart from Australia and New Zealand, Northern Africa, and Southern Asia had the highest mortality rates among those aged 10 to 24. In Sub-Saharan Africa, the likelihood of a 10-year-old dying before age 24 was on average 6 times greater than it was in North America and Europe. Main health issues. Injuries. Teenagers are most frequently killed and disabled by unintentional injuries. In 2019, road traffic incidents claimed the lives of over 100,000 teenagers, 10 to 19 years old. Numerous fatalities involved pedestrians, bikers, or riders of motorized two-wheelers, all of whom were considered vulnerable road users. It is necessary to increase their enforcement and broaden the scope of many nations' laws governing road safety. Young drivers also need guidance on safe driving practices, and regulations that forbid driving while intoxicated or under the influence of drugs must be strictly enforced for all age groups. Young drivers' blood alcohol levels ought to be lower than those for experienced drivers. It is advised that new drivers have graduated licenses with zero tolerance for drunk driving. Among the leading causes of mortality for teenagers is drowning. In 2019, it is anticipated that more than 40,000 teenagers, more than 75% of them were boys, died by drowning. One of the most important interventions to stop these deaths is swimming instruction for kids and teenagers. Violence. One of the top causes of death in teenagers and young people around the world is interpersonal violence. Its importance varies greatly between global regions. It accounts for over a third of the mortality of male adolescents in the WHO region of the Americas low and middle-income nations. In the Global School-Based Student Health Survey, bullying was reported by 42% of adolescent boys and 37% of adolescent girls. Youth are also disproportionately affected by sexual violence. 1 in 8 adolescents report experiencing sexual abuse. The risks of injury, HIV and other sexually transmitted infections, mental health issues, poor academic performance and dropout, early pregnancy, issues with reproductive health, and communicable and non-communicable diseases are all increased by violence during adolescence. Promoting parenting and young children's development, tackling bullying in schools, developing life and social skills through programs, and using community-based tactics to restrict access to alcohol and firearms are all examples of effective preventative and response measures. The physical and psychological effects of adolescent survivors of abuse can be mitigated with effective and compassionate care, which includes continuing support. Mental health. Suicide is the second leading cause of mortality for those between the ages of 15 and 19 years, and depression is one of the major illnesses and disabilities that affect teenagers. 16% of the worldwide burden of disease and damage among people ages 10 to 19 is attributable to mental health problems. Half of adult mental health illnesses begin by the age of 14, however the majority of instances go undiagnosed and untreated. Adolescents' happiness and mental health are influenced by a variety of circumstances. Living in humanitarian and unstable environments, poverty, stigma, marginalization, and violence can all raise the likelihood of mental health issues. If adolescent mental health issues are not treated, the effects can last into adulthood, affecting both physical and mental health and reducing opportunities for people to lead satisfying lives. It is possible to encourage excellent mental health in children and adolescents by developing their socio-emotional abilities and offering them psychosocial support in educational and other community settings. Programs that work to enhance the conditions at home and the bonds between young people and their families are also crucial. If issues do emerge, they should be quickly identified and handled by skilled and compassionate healthcare professionals. Alcohol and drug use. Teenage alcohol consumption is a big issue in many nations. It can decrease self-control and boost harmful behaviors, such as unsafe sex or reckless driving. It is a root cause of injuries, particularly those brought on by auto accidents, violence, and early demise. Additionally, it can reduce life expectancy and cause health issues in later years. Around the world, 155 million teenagers, or more than a quarter of all those between the ages of 15 and 19, currently drink. In 2016, 13.6% of adolescents aged 15 to 19 reported engaging in excessive episodic drinking, with men being the most vulnerable. With 4.7% of those between the ages of 15 and 16 reporting using it at least once in 2018, cannabis is the psychoactive substance that young people use the most frequently. Drugs and alcohol. The use of alcohol and other drugs by kids and teenagers is linked to neurocognitive changes that can subsequently result in behavioral, emotional, social, and academic issues. Public health initiatives that focus on preventing alcohol and drug use may include population-based strategies and interventions, as well as initiatives that are conducted at the individual, family, community, and educational levels. One of the main methods for lowering teen drinking is to set a minimum age for purchasing and consuming alcohol, as well as to stop marketing and advertising to minors. Tobacco use. The great majority of tobacco users now started smoking when they were young. It is essential to prohibit the sale of tobacco products to people who are under the age of 18, raise the price of tobacco goods through increased taxes, outlaw tobacco advertising, and provide smoke-free settings. Around the world, at least 1 in 10 adolescents between the ages of 13 and 15 smoke, while there are places where this number is far higher. HIV/AIDS. In 2019, 1.7 million teenagers, aged 10 to 19, were anticipated to be HIV positive, with the WHO African region accounting for 90% of those cases. Teenagers still make up about 10% of new adult HIV infections, with adolescent girls accounting for 75% of those infections, despite significant decreases since a peak in 1994. Additionally, even while the number of new infections may have declined in many of the nations with the worst epidemics, recent testing rates are still low, suggesting that many teenagers and young adults with HIV may not be aware of their status. The availability of antiretroviral therapy, adherence to therapy, retention in care, and viral suppression for adolescents with HIV are all worse. The lack of adolescent-friendly services, such as support and psychosocial therapies, is a major contributor to this. Teenagers and young adults must understand how to prevent HIV infection and must have the resources necessary to do so. This involves having improved access to HIV testing, counseling, and pre-exposure prophylaxis, as well as stronger connections to HIV treatment facilities for those who test HIV positive. HIV prevention strategies include voluntary medical male circumcision, condoms, and pre-exposure prophylaxis. Other infectious diseases. Adolescent mortality and disabilities from measles have significantly decreased as a result of increased childhood vaccination. For instance, the African region had a 90% reduction in adolescent measles death between 2000 and 2012. According to estimates, the top 10 causes of death for teenagers between the ages of 10 and 14 include pneumonia and lower respiratory tract infections, diarrhea. Meningitis and these two illnesses are among the top 5 causes of teenage fatalities in low and middle-income African nations. Infectious conditions, such as the human papillomavirus, which typically appear after the commencement of sexual activity, can result in both a short-term condition, genital warts, during adolescence, and a longer-term condition, cervical and other cancers, decades later. The best time to protect against HPV infection is during early adolescence, 9 to 14 years, and if 90% of girls worldwide receive the HPV vaccine, more than 40 million lives could be spared over the course of the next century. However, just 15% of girls worldwide are thought to have received the vaccine in 2019. Early pregnancy and childbirth. Each year, at least 777,000 girls under the age of 15 and about 12 million girls between the ages of 15 and 19 give birth in developing nations. Pregnancy and delivery complications are among the major causes of death for females between the ages of 15 and 19 worldwide. According to the UN Population Division, country rates range from 1 to over 200 births per 1,000 girls this age, with the global teenage birth rate in 2020 estimated to be at 41. This shows a notable decline since 1990. This trend is reflected in a corresponding drop in maternal death rates among females between the ages of 15 and 19. By 2030, the world should guarantee universal access to sexual and reproductive healthcare services, including family planning, information and education, and the integration of reproductive health into national strategies and programs. This is one of the specific goals of the Health Sustainable Development Goal, SDG. Comprehensive sexuality education, which is a curriculum-based process of teaching and learning about the cognitive, emotional, physical, and social elements of sexuality, is something that adolescents need and are entitled to. A decrease in the number of girls getting pregnant and giving birth at too early an age can be achieved through improving access to contraceptive information and services. Enforced laws that set the marriage age at 18 can be beneficial. Access to high-quality prenatal care is necessary for girls who do get pregnant. Adolescents who choose to end their pregnancy should have access to safe abortions where allowed by law. Nutrition and micronutrient deficiencies. The second most common reason for adolescent years lost to death and disability in 2019 was iron deficiency anemia. Supplements including iron and folic acid are an additional method for promoting health prior to adolescent parenthood. To avoid micronutrient, including iron, deficits, regular deworming is advised in regions where intestinal helminths like hookworm are prevalent. The cornerstone for excellent health in adulthood is the development of appropriate eating habits in adolescence. Access to healthy foods and a reduction in the promotion of foods high in saturated fats, trans fats, free sugars, or salt are crucial for everyone, but especially for kids and teenagers. Undernutrition and obesity. Many boys and girls in underdeveloped nations are malnourished when they reach adolescence, which increases their risk of illness and early death. On the other end of the spectrum, nations with low, moderate, and high incomes are seeing an increase in the proportion of teenagers who are overweight or obese. Over 1 in 6 teenagers aged 10 to 19 were overweight globally in 2016. Between less than 10% in the WHO Southeast Asia region to over 30% in the WHO region of the Americas, prevalence varied among areas. Physical activity. Adolescents who engage in regular physical exercise benefit from a variety of fundamental health advantages such as increased cardiorespiratory and muscular fitness, bone health, maintenance of a healthy body weight, and psychological advantages. The World Health Organization, WHO, advises teenagers to engage in at least 60 minutes of physical activity every day, on average, over the course of the week. This can include play, games, and sports, as well as activities for transportation, such cycling and walking, or physical education. Only 1 in 5 adolescents worldwide are thought to satisfy these standards. Countries, societies, and communities must offer environments and opportunities for physical activity for all adolescents in order to boost activity levels. WHO response. Global Accelerated Action for the Health of Adolescents, AAHA. Guidance to facilitate country implementation was a significant publication released by WHO in May 2017. The comprehensive consultations with member states, UN agencies, adolescents and young people, civil society, and other partners resulted in the AAHA guidance, which is based on those contributions. It aims to support governments as they choose what to do and how to do it in order to address the health needs of adolescents in their nations. To aid in the planning, execution, monitoring, and evaluation of adolescent health programs, this reference guide is directed at national policymakers and program administrators. Teams from more than 68 nations have received training on how to use the AAHA guidelines for national priority setting, programming, monitoring, and evaluation. Many nations are already adopting the AAHA approach to update their national strategies and policies. Thanks for watching, and more healthy facts to come. Have a healthy day.